for many of these women, this sudden transition begins to occur 6 to 8 weeks prior to labor. Like that's when you should be watching the closest. It could have been, happenstance that every other time that they had gone in for their prenatal checkup, that their blood pressure checked out just fine. But that continuity of care isn't there because no one's continuing to monitor that patient and is not necessarily monitoring that particularly as close as they could be. What are your thoughts around that?
It depends on where, because in England, we've got a structured prenatal care package that's offered. Mm-hmm. So basically, by the time you find out you're pregnant, you go to see your GP. Your GP then checks you out, sends you to the hospital for booking. You're seen by a midwife, and you're then determined if your care or shared care, if you're high risk, so your shared care, you're being seen by a midwife and a doctor. And if you are low risk, then you're seen by a midwife. Then they will structure when you have your scan, when you come in, you have your blood test done, and when you're seen. So that's a very structured approach. Sometimes we have people who come in the A&E department and they've never, ever had any bookings or any inclination of prenatal care. And sometimes we have late bookings by the time they come to us. You think of 20 weeks and above. So you can get all these different scenarios in terms of care. In America, I'm not sure, what is the system in terms of someone coming in? Fran, just so I can understand that. In the UK, it's different.
Yes. And one of those things is midwives. It's taken some time for us to sort of mainstream or popularize the role of the midwife, even though it's been such an integral one for so long, so traditionally. But in either case, whether it is a midwife or obstetrician that is seeing the patient, they'll come in for their visits and the same vital points or data points are collected. But I think that an element that is missing is, again, exactly.
That's where the digital platforms can come in.
You literally just took the words out of my mouth.
Yes.
And that's where that come in to provide that gap.
That's exactly right. So Lena, tell us more. What are your thoughts on that, on the application of digital technology to help?
It has arrived, Fran, and I think COVID-19, this whole thing has been really bad. But one thing it has taught across the world and through all public health, social care, and actually clinical side as well, is that the 3 C's, which is collaborate, communicate, and connect. And that means that the digital health is here. Last year, this time, we would be convincing people that you have to go down the digital transformation road. But now in this pandemic, which we all witnessed, right, it is here. And I think more for maternal health, to be honest, it needs to be there. So you need to be easily, so you can take the readings easily as well for blood pressure or diabetes and weight, which is a complete clear, crystal clear, something like My Self-Care, which is a good platform, and things can be recorded. And then your clinicians can intervene as well. Now, for me personally, I think digital therapeutics is a route and a move ahead. Because if you want to look after your population health from 1 to 3, how soon can you actually go from 1 to 300 or to 300,000 people? Right. And that is through the most evidence, effective, intelligent information is through your digital technology.